Well, normally a legislator would speak up if they didn't have the answer.
Yeah,
I'll ask them.
I know what I know.
So, also, if you want extra time for your opening, too, just so you can.
Okay. Oh, okay. That's good. Good to know.
All right.
Here's two to start out with.
I got two questions.
Already?
We're going to get started in just a minute. I want to give everyone a chance to get settled. Representative Neighbor, somebody in her family is ill, so we don't believe she's going to be joining us today. So it's going to be a cozy room today. This is already on. Good morning. Thank you for joining us at the Legislative Coffees. It's our 9th year hosting these. Since we only have one legislator with us today, we're not going to do timekeeping, so she has free reign to speak about whatever she would like, as much as she would like.
Not always a good thing.
Use that. So most of our ground rules are thrown out the window today, but I do want to maintain, please don't clap, please don't boo. I'm sure that there would be no booing today, but just in case. No clapping, no booing, and then I would like for us to maintain a tone of mutual respect. 95% of Americans say that mutual respect is the first step in a more productive government. Can't agree on very much, but we can agree on that. So hopefully this room can agree to that as well. So with that, I'm going to hand it over to Representative Ruiz and let her share what's going on with her committee work and in Topeka.
Thank you so much. Thank you for everyone that's here. And I know we all have very busy lives, and I feel that it's important that our legislatures, our individuals in the legislature make themselves available publicly for questions. I'm not going to know the answer to probably at least 50% of the questions you might ask today. But I do think it's important that we are here in person when we can. Now that we are on the other side of the pandemic, hopefully, that we can be able to be available to folks. So I am Representative Susan Ruiz, and I live in Shawnee. My district is Shawnee, Lenexa, and Overland Park, but the bulk of my district is actually Lenexa, and I brought a map because it is, if you see the map, it's hard to describe where the boundaries are, so feel free to come and look at the map and kind of see, you know, if you're in my district, I would love to be able to speak with you one-on-one if we could. I was elected in 2018, and I am serving my third term. And I'm a transplant from Texas, from Houston, Texas, came to Kansas in 1993. I'm a clinical social worker, and I still am a clinical social worker, and I am very lucky to be able to work as a social worker at one of our local hospitals. And they've been very, very good to me, allowing me to work very, very part-time for them so that I can do the bulk of my work in the legislature. But as we all know, the salary for the legislature doesn't pay a whole lot, so I do need a second job to be able to do that. When I ran in 2018, I felt like, and if you know the 75th and Quivira area, which is where my house is, you'll know that it's in a very diverse community. And I was looking for that when I moved to Johnson County. And I just felt like Shawnee was a great place to live. I'd heard so many good things about Shawnee. And being able to get on the freeways, the two major freeways, was really important for me. I was still working in community mental health centers. So being able to live there and have the diversity and know the diversity that is there was really important to me. I felt that we did not have representation. when I looked at folks in the legislature, I didn't see people that looked like me. And so I wanted to be able to represent more folks within Shawnee. And so I ran, was elected, and again, I'm in my third term. Because being a clinical social worker, I have primarily been on committees that have to do with social services. So I've been on pretty much these same three committees. I'm on the Veterans and Military Committee. I'm ranking member on Health and Human Services, and then I'm also on the Social Services Budget Committee. Three very strong committees, and I just feel really good about the work that we've been able to do. The other thing I like about the Social Services Committees is it's one of the few committees where you can actually do bipartisan work. There are some things that we can find to compromise, and I feel really good about the work that we've done so far in those committees and some of the things that we might be looking at in the future. So I don't know. I don't want just full reign here. So I work easier if I have questions.
And we do already have a few questions coming in. If you have a question, there are note cards in your chair. If you're online, in the description for the video, you can submit online questions. If you have a question, just hold it up and somebody will be by to collect it. Please submit them. That's what we're here for. So I have our first. What benefits will we see from increased tax revenue from legalized sports betting?
That is because that is still so new. We're not going to see a lot of revenue yet with that. I think the revenue projection was going to be pretty low with that, and I'm not really even sure what we have gained so far, but I know that when we voted that in, that the revenue was going to be low, and you would expect that at the beginning. I'm sure they're going to have to make some adjustments to that. So I don't think we're going to see very much yet.
All right. The GOP continues to ignore the public will of Kansas by introducing anti-abortion legislation. What can be done to stop them?
Your voice. Your voice was loud and clear on August the 2nd. And it was very disheartening to hear that the president of the Senate said that the conversation wasn't over. It is. It was decided on August the 2nd, and there shouldn't be anything else. We need to continue to remind our legislators that was decided on August the 2nd. It's really our voice. That's the power that we have is our voice, and being able to communicate as much as you can to your legislators, via email. If you want to go visit, you have every right to come to your house at the Capitol. It is your house. And you come and you talk to your legislator, and you ask to see them one-on-one if you want, or if you can go 2 by 2, doesn't matter. You have a right to be able to be in front of your legislator and have your opinion about that, whatever that opinion might be. But it was decided on August the 2nd, and access to reproductive health is extremely important, and the legislature has no business dictating what you do with your body.
All right, our next question. The elimination of the food tax intended to provide relief from Kansas at the grocery store. With inflation wipe that relief. What can be done to reduce food costs for Kansans?
We are going to see some there are already some bills that are being that have been introduced to help lower some of those costs. The governor she has a proposal to eliminate the food tax immediately, so that we would see an immediate reduction going from that 6%. It's gone down to 4%, and then bringing it down to 0, and it would happen this year. So we are very busy. The governor's office is busy talking with other legislators, talking with Senate, talking to the House, that for us to pass that bill. She's also proposing a reduction in the tax. There's zero tax on feminine hygiene products and on diapers. There are two other bills from two other legislators that are also basically going to do the same. One of the bills opens it up to even more. It would be more hygiene products in the sense of like even dental floss, things like that, that would again help us to lower the expenses that we, the things that we buy practically on a daily basis. And you think about diapers. I don't have a child, but I know what parents go through with just the diapers. And you think about the volume of diapers that you're buying for a newborn. Well, imagine if you are on a very limited income, and you may be even receiving Medicaid. You're not receiving a lot of money from the state to be able to afford the diapers alone. And so folks rely on going to maybe food pantries or other organizations to help to provide those diapers. And if we can lower that tax, that would be great. The other thing is the governor's also promoting that sales tax, the elimination of the tax for school supplies. And it's she's proposing a 4-day tax-free school supplies, just the way like Missouri does now. So that's also in the works. And so we're working hard to get people to, to vote that in. And it's not going to be really easy, but again, your voice counts. Contacting your legislator and asking them, and especially the Senate. We are in Senator Mike Thompson's district right now. He needs to hear from Shawnee loud and clear, and he needs to hear from the people in his district that the need for this, because the Senate, it's got to go to whether it's going to go from the Senate to the House or from the House to the Senate. We need more people. We need Mike Thompson to say yes to these kinds of bills. He needs to hear loud and clear that we need this, and the savings that we would have for the people in Kansas. Again, you have no idea how much power you actually have with your voice. And things I know don't always go our way, but the minute we stop, then they'll say, see, they didn't really want this. We have to just relentlessly be in contact with them and tell them, give them stories. If you struggle to pay for your food, if you struggle as a parent trying to buy, or a grandparent trying to buy diapers, give them stories. It really goes across really well, versus more of a form kind of letter. Give them personal stories that they can talk about.
Should we be expecting bills that will threaten public health practice and authority, thanks to the immunization policies?
There is at least one bill that has been sent to the Health and Human Services Committee, the committee that I'm on. And just know that just because a bill has been assigned to a committee, it doesn't mean it's going to get a hearing. So there's a couple of ways that a bill can be assigned to a committee. One is you can introduce a bill on its own, or you can introduce a bill in committee. When you do it on its own, then leadership assigns it to a specific committee. If you introduce it in that committee, then more likely than not, it's going to stay in that committee. But it doesn't guarantee a hearing. The chair of each of those committees, along with the leadership, they decide what's actually going to be heard within committee. So there is a bill that was introduced very early on, and it is sitting in Health and Human Services. But again, there is no guarantee that that bill is going to be heard. I don't know if there's an equivalent in the Senate, but I'm assuming that there is. So if you know how to track bills, that's awesome. If you don't, I would love to show you, because I can show you on your phone on how to do that, how to look it up just looking at specific committees. Now I can show you how to get into the Health and Human Services Committee and see all the bills that are sitting there. So when you see that there's a bill sitting there and it's a bill that you want to speak to, you'll also see everybody that's on that committee. It's on the left of the right side. So you can then email individual legislators on that committee, whether it's in the House or in the Senate. And I would love to show you how to do that because, again, information is power. It gives you information to tell, rally around certain things or to be against certain things. And then you can track it. So if it does get a hearing, you can ask to come to the committee and testify either for or against it. So that's another way of being able to have your voice heard.
What is the legislature's role in increasing housing? Sorry, sometimes handwriting's hard for me. Versus local solutions. Specifically, what can be done legislatively to increase affordable housing and wrap around services for our houseless and at-risk families and seniors? Where do you see bipartisan support for this?
We are seeing more and more bipartisan support for this. The governor, last session, there was funding that was given to an initiative to have more housing in the rural parts of Kansas. But there was a certain population. There was I can't remember what the population had to be in order for that community to access some of those funds. This session, the governor is going to look at funding for housing, but it's going to be, we're going to try to tap in more into the urban areas with that. There are local, I am for local control, but there are ways that we can partnership with municipalities, with the legislature, with the governor. We can look at funding within the state. We can look at grants, but we can also pull federal money together for that because there is federal money out there for that. Johnson County is really good about looking at grants, for housing, and so a lot of the grants that are out there, you can't necessarily build, but maybe you can rehab, things like that. So, and the other piece with housing that for me, I'm a senior citizen now, in being able to help seniors age in place. A lot of people don't want to move from their home and go into, like a nursing home, maybe if, they're able to be at home, but maybe they need some modifications done. And one resource that I recently found out that in the city of Shawnee, you can have someone come to your home. If you're trying to age in place, you can come to your home and they can look at your house and just help you see where there's some things that could be modified in your home in order for you to be safer in your home, and then help you with resources to make some of those modifications, like maybe putting a bar, by the shower or the tub, those, or a ramp, those kinds of things that the city can do that. They will come and help you with that. So there are some initiatives that we are trying to get right now. They've seen some success with the funding from the state and from the federal government in the rural parts of the state. So now it's coming more northeast to us.
What issues would you consider the most pressing in the 2023 legislative session?
Medicaid expansion is number one for me, and I think for so many people. the Hayes State University's done for years have been done surveys regarding certain topics. Medicaid expansion is one of them. Medical marijuana is another one. And what they're saying for Medicaid expansion is 7 out of 10 people are agreeing that we need Medicaid expansion in the state. We have business entities, we have local chambers that are coming to us and saying that this is it's not just more access to care, it's an economic, value for us, because we've got small businesses who maybe can't afford to pay for health care for their employees, and maybe their employees would qualify for the Medicaid expansion part of it. That could keep small businesses afloat by doing that. And side by side with that is access to daycare. So, I know that the governor is very, very strong about us finding ways to increase daycare or access to daycare. For me, it kind of goes hand in hand. If you're able to have medical coverage and gives you access to health care, maybe that gives you more money to be able to put food on your table. You're not having to make those decisions. Do I go to see the doctor today or do I feed my children? Those are the kind of decisions that people are having to make. So Medicaid expansion absolutely will help for that. Also, it would help with agencies, organizations who are providing health care and providing mental health care also, because they're doing millions of dollars of uncompensated care. Johnson County Mental Health does millions of dollars every year of uncompensated health, because they are part of the community mental health system. So regardless of if you have the ability to pay, you can access mental health services. And one of the things that a lot of people don't know, if you have a severe mental illness or you have a loved one who has a severe mental illness, they can live in the community. They can live their very best life. And a lot of times all it takes is for someone to help them live in the community through case management. And if they're able to do that, so many people can live their best life. But the only thing that'll pay for that is Medicaid. My Blue Cross Blue Shield doesn't pay for that. It'll pay for if you have therapy or if you want to see the psychiatrist. But it's not going to help to help a person live in the community, stay living in the community, go from homelessness into an apartment and have those services that'll help them stay in the community and work in the community. Medicaid's the only thing that'll pay for that. So the Johnson County Mental Health, there's 26 community mental health centers in the state. They would then be able to have more revenue that would then be able to turn it into higher salaries for their staff and have a wider access to services. There are a community primary care clinics all across the state. There are, I have visited them, and they do amazing work in the healthcare field. And they do millions of dollars in uncompensated care. And again, if we had more people with Medicaid, they can then in turn be able to provide more services for people who don't have insurance. The other piece with that Medicaid expansion is there are folks that fall kind of in the middle. You're not poor enough to get Medicaid, and you make too much in order or if you're poor, you might not be able to go on to the get affordable health care. But there's those who are underinsured. You have insurance, but it doesn't quite pay for everything. A lot of those folks, they fall in the middle. And so again, Medicaid expansion would help them.
How can we prevent the situation regarding the 3-year-old girl in Gardner being removed from her foster parents since birth and relocated to a family in Manhattan? Doesn't this discourage foster families?
I'm sorry, can you read that question again?
Yeah, definitely. How can we prevent the situation regarding the 3-year-old girl in Gardner being removed from her foster parents since birth and relocated to a family in Manhattan? Doesn't this discourage foster families?
I hope it does not discourage foster families. We obviously have a very big shortage of foster families. I hope it doesn't. Child welfare is an extremely complicated system, and we now have a department. It's a child advocate department that will look at situations like that one that you described and help try to be like an intermediary. That department is still very new, and it would have been better if that department would have handled things versus it coming to a committee, because that is just one situation, and there's lots of those kinds of situations. The legislature in the individual committee, and I was on that committee, in my opinion, it's my opinion alone, that is not something that the committee really should have tapped into at all. We need better ways of handling situations like that because they're extremely complicated. I'm a social worker. I do not work with children. I have never really worked with children. That is not, and I, that is not something that I should have any decisions into because I don't know the system well enough. I don't work with children. I don't know the child welfare system, and it is something that people with better expertise, that it's better for them to help right a situation. And there's just more. There are more kids like that, and it's really hard when you have a family where there's more than one child. Do you keep the children together, or do you split them all up? And the thing that we heard in the committee, there was an adult who works in the child welfare system who was split from her siblings when she was a little child, and still has struggles with that, trying to stay in contact with her siblings. And so there's just so many things. There's so many nuances to that it's hard to just come in and make some kind of a decision. I didn't like that we were doing that, and I just think that is better handled by entities that know the child welfare system much better. And it's hard to make a decision, a global decision, or make a generalization over one situation. And I know that there's situations like that all across the state, but it's hard. These are all individual kind of situations, and there's so many things that have to be considered. And again, my opinion is experts need to be helping make those decisions.
I think we have a couple of questions up front. You can hold them up. Somebody will be by to get them. Is there a tax break for sports betting, and how much of that goes towards lobbying?
That I do not know. I don't know what goes to lobbying. We all know that there are lobbyists that come out for all kinds of interests. And yes, the sports betting, probably maybe that question is because of what was discovered during the summer about how lobbyists were very involved with the sports betting situation. So I have no clue as to how much the lobbyists are making off of that. I can't even begin to figure that out.
How are legislators planning for the Kansas City hosting of the World Cup in 2026?
There's been no discussion in the legislature for that.
And I think that I need a question. One's coming.
I'm trying to get over a sinus infection, and so I'm drinking a lot of water.
With the decriminalization of substance use coming, how will we support substance use recovery? Substance use in youth is a concern.
I'm not sure about the decriminalization of substance use. Is the question regarding medical marijuana? Yes. Okay. Okay. There's not been. I think the majority of the legislature is for medical marijuana. It is being held up by one senator. It's the president of the Senate. He's holding it up. I think we have the votes both in the Senate and in the House. I think we all know the benefits of medical marijuana, and yes, we also know that they're the negative side of that. If we can get this passed, then is there an avenue for recreational? Probably. It's all around us, and that's when we'll really have to look at the decriminalization part. Like Missouri is just now doing their decriminalization, and they've had medical marijuana going for almost a year, I guess, or at least a year. And I know they just passed their recreational. Doesn't always mean that if you have medical marijuana that you're going to have recreational. But I think, again, if we look at the Fort Hayes surveys that they're doing, there's many people are in favor of medical marijuana, and there's probably even more in favor of recreational. So that is going to be something that we will have to absolutely look at, the decriminalization of substance use. So there's still a lot to do, but first we need to pass medical marijuana first. Again, the stories matter. If you tell your senator or your representative stories about why you think medical marijuana is important, we know how it relieves those who are suffering with cancer. The pain that people endure, and you're filled with opioids. Opioids have a lot of side effects. People don't talk about those side effects. Those side effects are horrible. And just being able to use medical marijuana can sometimes, you can almost cut that opioids in half, if not totally, and not have all those other horrible side effects. You're already in pain, and then also have all these other horrible side effects. It's there's so many stories that I've already heard, and I've had loved ones who have died from cancer, and know how much better it would have been if we'd had medical marijuana. So those stories matter. Please tell them to your legislator.
Will the statute of limitations on abuse and systems that allow abuse due to lack of transparency be extended? How do we make change happen to protect the public from systemic abuse? Example, 188 cases from the Catholic Church report from the FBI.
If there was there was a study that was done, and the results of that study was released a month ago or so. It's horrible. It's a horrible report. There are at least 14 in that whole report, and I don't know if they were all priests, but there's at least 14 cases that if we didn't have the statute of limitations, that they could be charged immediately. That statute of limitations, because we have it, prevents us from being able to, it prevents those who were affected from making those charges and, making those police reports. Senator Cindy Holscher in the Senate has introduced a bill. She introduced it last session. She might have introduced it even the session before that, and it goes nowhere. I think we have a much more bipartisan support for it now. I am very hopeful that we're going to be able to pass this bill, at least to have it given a hearing. We've not even had a hearing for it. And so I'm very hopeful that we're going to be able to have a hearing. We're putting a lot of pressure internally. Many of us are talking to other representatives and senators and talking about the importance of passing this bill that eliminates that statute of limitation. And because this report came out and made it very, very public, people can't deny that it's not happening. It's right there. So, yeah, I'm very hopeful that we're going to be able to pass this bill.
Thank you for your hard work and representation for the LGBTQ equality. How can we support you and the LGBTQ caucus to get beyond opposing bad bills and promote good bills that you've introduced, like adding LGBTQ people to the Act Against Discrimination?
Thank you for that question. I'm gay, and I'm serving my third term. And I will tell you that when I went knocking on doors, and I knocked on a lot of doors, no one ever asked me about me being gay. Nobody had any questions about that, because we found common ground. And that's what that was about. We always found common ground of where we could work together. And me being able to listen to folks and say, yes, that's where we need to work together. No one ever questioned that, and I just I'm kind of a rare person, because I have colleagues who went through a lot when they were knocking on doors. I've talked to other LGBTQ representatives and senators from other states, and they've faced so much discrimination. In Kansas, we have kids who are killing themselves. They are completing suicide because of not being accepted. They're not accepted in their homes. They're not accepted in their churches. They're not accepted in oftentimes in schools. They're bullied. And then you have a legislature who is just stomping on them. And it's really hard to talk about, because it's real. These kids are killing themselves. If we don't think that they're watching us, then we're ignorant, because they do. They watch us. They know how to track bills. They're tracking bills. They are listening to sessions. They are watching committee meetings. They're coming together and doing that. And they're also being vocal. They're becoming more and more involved in speaking up for themselves. And that takes so much courage. I, as an adult, I can take it. But you got a 12-year-old who comes to the legislature and speaks before a committee to say that I deserve to have rights just like you do. I deserve to not be bullied and be singled out and used as a political pawn. And they're not listened to. We still end up having to fight these bills as they come forward. Thank goodness that there are so many allies that we have who are willing to come and rally with us and help us out. There are 3 of us that are gay on the legislature, in the House. But we have so many allies. There's so many organizations out there. And they come to help us try to stop these bills. Kids want to come and talk in front of these committees. It takes a lot of courage for them to do that. And we want to support them as much as we can. If you're an ally, let them know that you're an ally, that you're a safe person to come and talk to, and that you're willing to come to the legislature and speak before these committees, whether you have a loved one who is gay or not. Maybe you want to come and you just want to protect kids so that we stop hurting children. And the biggest thing is that they're being used as political pawns. Nobody wants that for their child. Nobody wants that. They all deserve to live the best life that they can. And you've got teenagers. You know what it's like to be a teenager. You're feeling your way around. You're trying to discover who you are. And they have a right to do that too, you know. These bills, especially the legislatures, are coming after trans kids in particular. And I don't understand why anyone thinks that that's okay to do. And what some of the things that hurt me the most is, again, these kids are being used as political pawns. But we're using religion as a way to discriminate kids. That's not what you use religion for. And if people say that they are Christian and they're okay with hurting children, that doesn't sound right. It's just wrong, and it confuses kids. So, there are 2 bills already out there that we're going to have to fight against. And again, having people come out and help us oppose those bills. There is a bunch of people working on that who are in the Capitol every day talking to legislators to try to get them to not grant those bills a hearing and not come to a vote in a committee or on the floor. So that's what it takes for us to do that. And again, for our allies to be able to contact their senator and the legislator to say, don't vote yes to these kinds of bills. Don't allow them to come to a hearing. And if you have the ability to come to the Capitol and testify against those bills, they need to hear us. They need to see you.
How are legislators supporting Kansas crisis intervention training for law enforcement throughout Kansas?
The community mental health centers they're very strong in Kansas, and we hear from them many times. And they are working with law enforcement, and to be able to provide the mental health first aid in particular. It's an 8-hour training. What we hear from officers and especially when you go into rural parts of Kansas, when you have maybe 4 or 5 sheriffs in the entire department, that what they tell us that it's hard for them to free up their officers to get 8 hours of training. And so what we tell them is, you don't have to do it in 8 hours. You can do it 2 hours at a time. You can do it, split it in half, do 4 hours, and then another 4 hours. And I understand that when you are in training as an officer and you go into the academy, there's a lot of things you already have to know. We understand that. It's the same thing with teachers. There's so many things that they have to do before school starts. Same thing with these officers. There's so many things that they have to know what to do before they're able to be a police officer. We have to put more of an emphasis on the fact that we need them to know how to intervene in those kinds of crisis situations. In Johnson County, we are very lucky to have crisis intervention teams. They're very specialized teams, and this is with mental health providers and law enforcement. They're very well trained. They know what they're doing, but it's hard for cities in other parts of the state to be able to afford that. It's a very expensive thing. City of Shawnee puts money into it. Overland Park, Lenexa, we have it everywhere in Johnson County. But it takes a lot. It takes a lot of funding to put that together. We have to emphasize the importance of that, and having, being able to tell to, the police union how important this is, because they've got a lot of say-so in this. They really do. So we need to be able to talk to them more and say why this is an important thing to have, and being able to understand how to deal with a situation when somebody is in a psychiatric crisis. So yeah, there isn't, as far as I know, there isn't funding that the state is putting with that. But there are avenues of which we could tap into some funding, but it's mainly the law enforcement agencies, whether it's the sheriff department or it's police departments. They have to have a buy-in on it. They have to be able to say, yes, we can do this, and this is how we're going to do it, because then we can help them find funding. The community mental health centers have the instructors to train. They're out there. They're ready to give that training. We just need to have law enforcement to agree to get that training.
This is kind of a follow-up question to that. With the recent death of a young man with a mental health crisis by law enforcement in Johnson County, how can we reduce the deaths of people with mental illness by law enforcement officers? Is it a need for more training? What is the solution?
Yes, and it does need more training, but it's also more awareness. Sometimes families don't really understand, even though we have so many resources in Johnson County, there's still families that don't know how to access those services. And Johnson County Mental Health does a fantastic job of getting the word out of how to access those services. And it's still we just need more people in the community to understand that. We have the 988 number now that anyone can call. And if you call that 988 and you're a veteran, it'll prompt you to press number 1, and then you end up talking to a crisis counselor who is also a veteran. But the 988 numbers are I don't have the current figures of how it's being used, but it's being used a lot. And so there are crisis interventionists on the other side of the line that will help to talk to, doesn't matter how old you are, they can talk to you and be able to access resources immediately. There are crisis teams that are being formed all across the state that can be mobilized to help individuals. The thing with the crisis teams is it isn't a 24/7. There aren't crisis teams that can mobilize with the police department during the night. So, and I can't remember what time of the day this happened, but in the evening time, there's a lack of that. So the more officers that are trained in mental health, the better we are. I think at least in Johnson County, our officers are trained better than other places, and I can't speak to other urban areas. I can only talk about Johnson County because it's what I know. But it does take continuous training on all the different interventions that could be used when a situation like that happens.
What actions are being taken to address climate change and the need to develop alternative energy sources now? What about credits for solar panels or electric cars?
Yes, I would love to see credits for. Right now, there's a federal rebate I think you can get if you buy an electric car, but there's some caveats with that. It has to have been made in the United States. So if you see some commercials with Kia, those cars, you'll hear it towards the end of the commercial. It'll say, "Made in Georgia." That's because they're trying to get people to buy those cars because you can get a rebate on those. But that's a federal thing. We don't have anything yet for within the state. The things that keep being brought up with the state regarding electric cars is the fact that they're not using the same amount of, well, they're not using gas. If it's a fully electric, then the state misses out on that gas tax. They're using our roads, you know, but there's no any kind of tax that's being imposed in order to help recoup, just like the rest of us have to pay, you know, taxes to help maintain our highways and stuff. So there's all that kind of debate going on. Same thing with the solar panels. Efforts continue to be out there. I know the governor is very much in favor of this, that we, because we're looking at wind energy. That's the thing that Kansas has, is a lot of wind. And so being able to work with that. The other piece is just looking at water, where the aquifer, the Ogallala aquifer, is dangerously low. There's water. Gee, I heard the years, how many years we still have with that, but I don't want to misquote myself because I don't really know. But it's not that far down the road. So there's a lot of things that have to be done with agriculture in order to help not deplete our water supply. I think cities and counties have probably better ways of being able to promote that. There's not enough promotion coming from our cities and counties to the legislature about the need for this. There's still too many just organizations that are in favor of it, of still working with the legislature to promote that. We need municipalities to come to really talk about that. And that is something that, you know, the city of Shawnee, since we're in Shawnee, the city of Shawnee could maybe make that more a priority. So being able to talk to local municipalities, you know, right now that's where I think our best way of influencing that at this moment.
Okay, we have one last question. What do you support in terms of creating a more fair redistricting process, and how can we get involved now?
Yeah, because that's what, 9 years from now. I'm very much in favor of having an independent committee do that. It's worked for other states. I think that is something that we need to talk about. We need to start talking about it now, absolutely. But as it gets closer, for sure, we need to have an independent committee do that. I'm very much in favor of that. We all know there's a lot of shenanigans that can happen with redistricting. Just look at this one. You'll see in my district this little point that's in there because they took out all of Old Lenexa, which I had before. Took it out. It does look like Tetris. So there's interesting things that were done with the redistricting, and the redistricting also, where it really created some issues, is with the school boards, school districts. That was really messed with. Of course, our Senate District 3 with Sharice Davids as our congressional representative. They cut up a whole county in half, Wyandotte County. So yes, an independent committee I believe would be better to create these maps, and we also have to make sure that we have that when the survey comes out, in order to count, you know, who is in our communities, that needs to broaden up. It was cut down a bit, and we didn't have enough time. The feds didn't give us enough time, and it was also done on purpose. Again, to try to disenfranchise our communities. So we need to have those surveys need to be broadened up. We really need to have more information about who is living in our communities, because there's so many things that are based on the census, and then have an independent committee draw up the maps.
Thank you so much, everyone, for taking time out of your Saturday, especially to Representative Ruiz. You were a good sport today. So there's still coffee and donuts in the back. If you heard something that you want to follow up on, her contact information is in flyers in your seats. I also emailed it if you're attending online. Yep. Thank you so much to everyone.
Thank you, and I'll stay. If anyone wants to come and talk with me, I'd love it. Thank you.